and she would like to give a little presentation regarding that particular drug and its uses and its disadvantages and so on. So I'll hand you over to Natalie.
Good evening, ladies and gentlemen. I'm Natty Simon, and I'm going to be talking about aspirin's link with cancer, and therefore the title of my presentation is Can Aspirin Prevent Cancer? Aspirin is an analgesic, antipyretic and anti-inflammatory medicine. Analgesic drugs act in various ways on the peripheral and nervous system. They are non-steroidal anti-inflammatory drugs, and they can be called the salicylates or opium or morphine as such. They are distinct from anesthetics, which reversibly eliminate sensation, so they instigate sensation as a drug. Antipyretics cause the hypothalamus to override an interleukin. Now, an interleukin is a cytokine that participates in the regulation of immune responses. Aspirin works by inhibiting the formation of a prostaglandin. Colon cancer prevention is an example of this, as the aspirin obstructs the substances that allow for successful cell proliferation. What are prostaglandins? Prostaglandins are a group of lipids responsible for the body's inflammatory response. They are responsible for the sensation of pain in the nervous system, which is also linked again with the hypothalamus. Aspirin puts a halt to the prostaglandin process. This is the organic chemistry model which explains the aspirin reacting with the synthase enzyme and changing it into a more manageable substance. It illustrates the process I explained previously. When aspirin reacts with H2 synthase enzyme, it produces an inactive compound known as salicylic acid, which causes the inactive response to further put a halt to the prostaglandin functionality. And the introduction to clinical trials. Recently there's been many clinical trials, both in America and England, concerning aspirin's link to putting a halt to cancer full stop. Aspirin was marketed at the beginning of the century as a preeminently effective painkiller. Preliminary evidence was exposed in early 2008 telling of a novel, incredibly important benefit of aspirin, its ability to reduce the risk of death from colon cancer. And this was the only cancer that it actually produced evidence of stopping. But since then there's been research on breast cancer and such cancers that really matter in today's society. A momentous study carried by the American Cancer Society proves that those who consume 16 aspirin tablets per month, which is not that much considering many people take it on a daily basis, especially if they have heart issues initially, lowered their risk of dying from colon cancer by 50%, which is quite strong in this field. More research, and this is UK-based research, says that 8 trials that lasted a maximum of 9 years lowered cancer death by 21% for those taking aspirin. The 34% reduction in cancer mortality after the initial 5 years of follow-up was due to taking it for the maximum of 9 years. 5 to 9 years was the main quota of aspirin consumption that caused most of the difference.